Good afternoon, everyone. Thank you for joining us today for our presentation for healthcare providers who want to learn more about becoming board authorized to treat workers' compensation patients. I'm Adam Rossi from the Communication and Outreach Unit at the Workers' Compensation Board. With recent increases to medical fee schedules and the adoption of the CMS-1500 Universal Medical Billing Form, treating patients in the New York State workers' compensation system is now more in line with mainstream healthcare than ever before. However, there are some things that set providers treating workers' compensation patients apart, and that's what we will review today. Also joining me today are Dr. James Tachi, the board's medical director, Stephanie Zuffali, the board's director of medical regulatory affairs, as well as Paula Rauch, Audrey Cunningham, Christopher Failing, Eileen Moss from our medical director's office. They will be on hand to answer any of your questions. We ask that you please keep your phone lines muted, as we will be using the chat feature to receive your questions today at the end of the presentation. But you may enter your questions throughout the presentation in the chat box, which should be located on the right side of your screen. Just use the drop-down to send your questions to all panelists. We will answer as many questions as we can, but if you have questions that we don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. So let's go ahead and get started. As mentioned, there are a few things that set providers treating workers' compensations apart from and that's what we will discuss today. The board has made great strides over the last couple years in terms of streamlining our systems and reducing the amount of paperwork, making it easier than ever before to be part of the workers' compensation system. We are working on taking the comp out of complicated. We hope to encourage not yet authorized providers like you to become board authorized. More treating providers means New York's injured workers have more options and better access to high quality health care. So let's take a look at our agenda today. We will start with a note about the expanded provider law. Following that, we will take a look at the various disciplines and review what they can and can't do. Next, we will provide a basic overview of the New York State workers' compensation fee schedules and the new and updated New York Medical Treatment Guidelines, or MTGs. We will also review the 3 musts when filling out the medical narrative reports. We will then take a look at some of the recent improvements the board has made to make its systems that make it easier than ever for healthcare providers to treat injured workers. Finally, we'll conclude with how you can apply to become board authorized. And again, we will leave plenty of time at the end of the presentation to take your questions. We'd like to start by sharing some background on the expanded provider law. As part of the 2019-2020 budget, a law was passed expanding the types of medical providers that can be authorized to treat injured workers in the New York State workers' compensation system, including licensed clinical social workers, nurse practitioners, acupuncturists, physician's assistants, occupational therapists, and physical therapists. Since the expanded provider law was implemented on January 1st of 2020, an influx of more than 21,000 healthcare provider applications have been processed to date. Currently, the board processes up to 375 applications per month, 50% of which come from the new expanded provider types. And the board is always on hand to help. We have responded to approximately 400 calls, emails, and letters each week, or about 4,800 per year. Becoming a board-authorized healthcare provider will allow you to treat and bill for workers' compensation services. Please note that all providers who can be authorized by the board to treat injured workers must be board-authorized to continue treating injured workers. The board has developed a chart that specifies what board-authorized providers can do within the New York State workers' compensation system. To view this chart, visit the provider page on the board's website at wcb.ny.gov and select the Expanded Provider Law section in the Resources section. Please note, certain urgent care, emergency room, out-of-state, and durable medical equipment healthcare providers are not required, and some are not eligible, to be board authorized to treat injured workers. Following providers are not required or not eligible to be board authorized to treat injured workers, though some cannot independently bill and treat: audiologists, dentists, massage therapists, optometrists, speech pathologists, occupational therapy assistants, physical therapy assistants, and durable medical equipment suppliers and labs. One of the actions the board has taken to improve the workers' compensation system for providers, and hopefully encourage more to participate, is to implement new fee schedules with higher reimbursement rates for all provider types, as well as additional increases for certain specialty provider groups. For example, Ground Rule 18 is the Behavioral Health Provider Enhanced Reimbursement. The board has established board-specific modifier 1B, which will provide a 20% reimbursement increase to providers with board-assigned rating codes for designated services. More information for each fee schedule is available on the provider section of the board's website at wcb.ny.gov. Another area of improvement for the board has been the recently updated New York Medical Treatment Guidelines, or MTGs. But first, a little background. In December of 2010, the board implemented legislatively mandated MTGs that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. In March 2013, the carpal tunnel syndrome MTG and the updated versions of the then existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The following MTGs are effective for treatment as of May 2nd, 2022. Knee injury, mid and low back injury, neck injury, non-acute pain and shoulder, ankle and foot disorders, elbow injuries, hand, wrist, and forearm injuries, including carpal tunnel syndrome, hip and groin disorders, occupational interstitial lung disease, occupational or work-related asthma, post-traumatic stress disorder and acute stress disorder, work-related depression and depressive disorders, eye disorders, traumatic brain injury, and complex regional pain syndrome. In order to assist healthcare providers with learning the ins and outs of the MTGs, the board has created MTG trainings. There are 2 different versions. One that provides CME credits for medical professionals and a non-CME version for non-medical professionals. To access these trainings, visit the board's website at wcb.ny.gov and navigate to the Healthcare Provider section in the middle of the homepage. Select the Medical Treatment Guidelines link. From there, select the training link on the right side of the page. You can access full details on these new and updated MTGs, including a PDF of the respective MTGs on the board's website at wcb.ny.gov. Select Providers on the top of the homepage. Scroll down to Resources and select Medical Treatment Guidelines under the Treatment section. We also have an MTG Lookup Tool in the medical portal. The MTG Lookup Tool allows users to quickly determine whether a particular condition or treatment test combination is recommended, not recommended, or conditional according to the MTGs. When a treatment or test name is selected, the relevant section of the full MTGs for that condition will display. This online tool will help speed treatment decisions and ultimately provide more effective and efficient care for injured workers. To access the medical portal and lookup tool, visit the board's website at wcb.ny.gov and select Medical Portal from the Online Services menu at the top of the homepage. Once you become a provider who is authorized to treat injured workers, you play an important role in making sure that injured workers receive the benefits they are entitled to, and we want to ensure you are paid promptly as well. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies most provider submissions of the CMS-1500 form. We'll dive into the CMS-1500 initiative shortly. The template includes 3 mandatory elements to include with narratives. They are the patient's work status, causal relationship of the injury or illness to the patient's work activities, and temporary impairment percentage. Again, we want to stress that this is imperative to include these 3 elements to ensure workers receive the treatment and indemnity benefits they're entitled to, and so you, as the provider, can be paid promptly. Additionally, a medical narrative report may be found legally defective if these elements are missing. A PDF of the report can be found at wcb.ny.gov/CMS-1500/requirements under the Medical Narrative Requirements section. For certain types of medical services or supplies, a medical narrative is not applicable. Instead, an attachment is required. For example, a radiologist should submit the radiological report with the CMS-1500, and a DME supplier should submit the physician order with their bill. A full list of attachment examples may also be found in the requirements section on the website. The chart shown here shows the legally required elements providers must provide when submitting a medical narrative report according to their specialty. You can view this chart at wcb.ny.gov/CMS-1500-requirements. Please note, a record, report, or opinion of a physical therapist, occupational therapist, acupuncturist, or physician assistant shall not be considered as evidence of the causal relationship of any condition to a work-related accident or occupational disease. Nor may a record, report, or opinion of a physician assistant be considered evidence of the presence of a permanent or initial disability or the degree thereof. When the medical narrative template is used, providers must attach a narrative report with clinic visit history examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, the diagnosis and assessment of the patient, and the plan of care. The board has been working hard over the last few years on 2 major initiatives to streamline processes and reduce paperwork in the workers' compensation system. The implementation of the CMS-1500 form is one of those initiatives. Providers had previously indicated that the unique paperwork requirements in the New York State workers' compensation system were time-consuming and cumbersome to complete. To reduce the administrative burden on board-authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS-1500 form, the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services as well as health insurers. The CMS-1500 initiative applies to medical bills for professional services as well as durable medical equipment or DME items. It does not apply to institutional or pharmacy billing, although non-network pharmacies may continue to bill using the CMS 1500. As of July 1st, 2022, providers must submit the CMS 1500 form. Electronic submission through an XML submission partner is strongly encouraged, though not currently required. As part of the initiative, use of current medical billing reports, including the doctor's initial report, Form C4, and the doctor's progress report, Form C4.2, is now discontinued. A full listing of discontinued forms will be discussed later on in this presentation. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. Payers are required to use the new Notice of Treatment Issue Disputed Bill, Form C8.1b, and Notice to Healthcare Provider and Injured Worker of a carrier's refusal to pay all or a portion of a medical bill due to valuation objections, Form C8.4, with applicable claims adjustment reason codes, called CARCs, to object to medical bills. Workers' compensation payers will electronically transmit the explanation of benefits and explanation of reviews, or EOBs, EORs, to their XML submission partners upon adjudication of the associated electronic CMS 1500 medical bills. Payers are also required to use specific CARCs on their provider EOBs, EORs when objecting to the payment of a medical bill, whether the bills are received through an XML submission partner or on paper. Again, once you become authorized to treat injured workers, you are encouraged to sign up for the medical portal so you may take advantage of all the online services the board offers, including preparing for electronic submission of medical bills to payers in the board. Once you have accepted the terms of XML submission agreement, you can then discuss details of submission with an approved XML submission partner, also known as a clearinghouse. We have received a number of questions about submitting the CMS 1500 form electronically. Here are a couple of things you should know. Electronic submission of medical bills by healthcare providers through an XML submission partner is strongly encouraged but not required. When providers submit the CMS 1500 forms electronically through an XML submission partner, the XML submission partner will submit the forms to both the carrier and the board. By moving to the CMS 1500 form, we have been able to reduce the number of forms which you can see listed here. The CMS 1500 must be submitted with a detailed narrative report to be considered a valid submission. The board has developed a template that providers can use to create the medical narrative report that accompanies provider submissions of the CMS 1500. A sample of the template can be found on the CMS 1500 requirements page. Now we'd like to take a minute to highlight the many benefits of electronic submission. Providers receive confirmation within 7 days that their bill was accepted or rejected by the payer. Providers typically get paid quicker. With acknowledgement of receipt from the payer, the provider is aware that they should not resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the payer to deny the bill. For more information, visit wcb.ny.gov/CMS-1500, or you can email cms1500@wcb.ny.gov. In March 2022, the board was pleased to launch one of its most significant initiatives to date, its new and improved business information system, OnBoard, which offers stakeholders, including healthcare providers, a much easier and more efficient way of interacting with the board. OnBoard replaces our multiple legacy paper-based claim system with a single web-based platform. Stakeholders are currently experiencing several major benefits with the new OnBoard system, but because building a new integrated system from the ground up takes time, we've kicked this initiative off with some high-priority processes that benefit from moving online. OnBoard Limited Release, or OBLR, is the first phase of OnBoard. It is designed to move key processes for healthcare providers and claim administrators from paper to online. Included is the prior authorization request, or the PAR process, for medication, durable medical equipment, and medical treatment and testing, as well as submission of requests for decision on unpaid medical bills, or Form HP 1.0. This is just one more way we are streamlining our processes to make interaction with the board as easy as possible for healthcare providers. Again, OnBoard has been live as of March 2022. Use of the new system was rolled out in 3 phases, beginning with submission of the PAR request for medication, known in the system as medication PARs. Today, providers and payers are using OnBoard to request and review prior authorization for medication, durable medical equipment, and treatment testing. And we have hundreds of these PARs successfully flowing through our system each day. Nearly 44,000 healthcare providers have registered for OnBoard, and more than 26,000 delegates have been added. Since OnBoard launched, nearly 25,000 PARs have been filed. Once you become authorized to treat injured workers, we strongly encourage you to sign up for OnBoard as soon as possible. Healthcare providers must use the medical portal to access OnBoard or to apply for or renew an authorization. The updated medical portal section of the board's website contains full details and information you need regarding how to register and get an ny.gov user ID and password to access OnBoard and grant access to others to act as your delegate. Visit the provider section at wcb.ny.gov/onboard for a guide on registration. Assigning delegates, such as your support staff, can assist you by drafting PARs, which must be reviewed and submitted by the healthcare provider. Drafting escalations to Level 2 medication PARs, which again must be reviewed and submitted by the healthcare provider. Drafting PAR escalations to Level 3 for medical director's office review and submitted by the healthcare provider to be reviewed. Responding to insurer requests for information. And drafting and submitting Form HP 1.0. Visit the link on this slide to view a registration guide for healthcare providers. We would like to note, however, that delegates cannot do the following. They cannot accept the XML submission partner agreement, register with the medical portal, or report on a provider's status. The board has developed a chart that outlines what submissions certain authorized provider types can make. You can view this chart on the provider overview page at wcb.ny.gov/onboard. So now that you have all the details on our system, we hope that you apply. To become a board-authorized provider, you would take the following steps. Step 1. Sign up to use the New York State Workers' Compensation Board medical portal and or log in with credentials that have been assigned to you. The medical portal is your one-stop shop to access training, the MTG Lookup Tool, the Drug Formulary Lookup Tool, and OnBoard, as well as a link to accept the terms of the XML submission agreement in order to electronically bill using a CMS-1500. Step 2 is to complete the required training specific to your profession. Step 3 is to complete the new provider authorization request online application. You can view who can do what in the medical portal on the healthcare provider overview page at wcb.ny.gov/medicalportal. For more information on becoming a board-authorized healthcare provider, please visit wcb.ny.gov/new-provider, or you can email provider@wcb.ny.gov. For more information on OnBoard, please visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for providers. For more information on the CMS-1500 form, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS-1500 initiative. That email address is cms1500@wcb.ny.gov. If you have provider-specific questions, you can call the helpline at 800-781-2362 or email WCB Medical Director's Office at wcb.ny.gov. You can also find the latest provider updates on the board's website. Visit wcb.ny.gov and select the Provider Updates quick link on the Provider page. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You choose the topics you'd like to subscribe to. You can follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. We hope you found this presentation helpful, and we will now take the rest of your time to answer as many of your questions as we have. Again, I do want to remind you, please keep your phone lines muted, and when you send your questions in the chat box, please make sure you send them to all panelists so that all of our subject matter experts on hand can see the questions coming in. I have seen a couple questions from people asking if we will have a recorded version of this presentation available. The answer to that is yes. We will be providing you with a recorded version of this presentation as well as a copy of the slide deck on our website. Please make sure you are signed up for email notifications so you are aware when those are available. And again, to sign up for email notifications, just go to our website, wcb.ny.gov. You can scroll to the bottom of the homepage and select Get WCB Notifications. And again, you choose the topics you'd like to subscribe to. So with that, there's going to be a brief period of silence as I see some questions have already come in. I'm going to let our experts review those, and we will be back with you shortly. Thank you.
Hey everyone, this is Dr. Todd. There's a question that states, I'm a psychotherapist located in a remote area of the Adirondacks. I'm in private practice and do not have support staff. I was previously discouraged from exploring workers' compensation because of the paperwork and records requests, etc. Basically asking, is that still the case? And one of the things that we want to emphasize with this talk is that, so there's always, healthcare is healthcare, right? And there's always paperwork and there's always that sort of thing. But one of the nice parts about the new system is that it has moved several processes online. And in so doing, we've actually gotten rid of several different forms. And as a recent provider, I've only been with the comp board a little over 2 years, and just a couple of years ago, I was, wrestling with all of the forms and whatnot that you were talking about, and that used to be very tedious. And most of those forms are gone, and we think that the onboard system and logging on and putting the patient information into that and having a central repository for the information has eliminated probably not all, but certainly the majority of the paperwork and paper shuffling hassles that you may have heard about in the past.
Hi, this is Paula. I'm one of the nurses in the medical director's office. There's a question from a social worker. Well, I'm assuming a social worker. It says, what is the progress once you receive a referral? Is there a certain number of sessions that must be completed or a specific assessment outline? There's not a set number of sessions that must be completed once the patient is referred. Treatment consistent with the guidelines for the specific diagnosis would not require a PAR, and you should refer to the appropriate MTG to determine the recommendations for frequency of assessment tools.
Hello. A couple of people asked whether they have to be a Medicaid provider in order to be eligible for authorization to provide services to injured workers. The answer is no. Participation in Medicaid is not required for healthcare providers. Should state that a DME vendor will have to have an MMIS ID number from the Department of Health within 6 months of the adoption of the current DME fee schedule, which came into effect April 4th. But despite that caveat, you do not have to participate in Medicaid as a healthcare provider in order to be eligible to participate as an authorized provider in the New York State Workers' Compensation System. Somebody also asked whether a New Jersey provider can apply to become authorized. The answer is, if that New Jersey healthcare provider has a New York State license, they have to be authorized in order to treat injured workers, if it's one of the provider types that require authorization. Other than that, if the New Jersey provider does not have a New York State license, they're not required to be authorized per se. Thank you.
There's another question that states, what is the difference in listing and recognizing causal relationship between PAs and nurse practitioners? So if you look at the slide which is also on our website, that basically talks about who can do what. When it comes to identifying causal relationship for a patient and for a few of the different activities, you'll see that PAs are allowed to do them and nurse practitioners are allowed to do them, but the PA entry has an asterisk next to it. And that asterisk, if you go down to the bottom of the chart, which is difficult to read in the slides, really only refers to the higher level of physician supervision that is required for PAs than nurse practitioners. But both are allowed to engage in all of those activities where there was a yes, including causal relationship determinations, which was the source of this question, but the PAs require a higher level of physician supervision.
Hi, there's a question as to whether or not clinical social workers may use the CMS-1500 form, and they can, in fact, use the form. CMS-1500 applies to all professional services billing, including clinical social workers. It does not apply to institutional hospital billing. That comes in through the UB04.
There's a question that says, can MDs, meaning physicians, MDs or DOs, co-sign for NPs and PAs? The answer is that physicians can co-sign for nurse practitioners. They have to co-sign for PAs. And just important to know also, though, that if the nurse practitioner or PA is the person who provided the services, the clinic visit is billed out at the nurse practitioner or physician assistant rate.
Someone asked about how to begin the process to be credentialed with the Workers' Compensation Board. A healthcare provider can go to our website. It's www.wcb.ny.gov. I'll put the link in the chat. And you click healthcare providers, and then you click apply for authorization. I'll put direct links into the chat for you.
There's a question whether nurse practitioners can see workers' compensation patients, and whether or not they can do so independently. And nurse practitioners can, in fact, treat workers' comp patients. They are eligible for board authorization.
So there's a question about patients with substance use disorders are you credentialing facilities, and how are you handling those patients with opioid disorders? Two things. So typically our credentialing is by provider, not by facilities. There are some exceptions and other rules, but generally speaking, it's individual providers who will become board authorized. And if the substance use disorder is deemed to be causally related to the individual's work and their workers' compensation claim, for instance, if it was consequential to opioid prescribing that was done for a work-related injury, and then the person had developed an opioid use disorder, then the person would treat for that disorder just like any other work-related condition.
Question here of how to get an email of the slideshow with the website and contact info provided. Again, if you go to our website, wcb.ny.gov, scroll down to the bottom of the homepage and you'll see a section that says Get WCB Notifications. You can sign up for emails there, and that's where we will be announcing when the recorded version of this presentation is available, as well as the slide deck. And then you'll have everything that was in this presentation today, including the information of who to contact. Actually, I will go back to that here, so you have that on your screen if you want to jot it down. But just sign up for email notifications. You'll be notified when this is available, and you should be all set there. I also saw a question from someone asking how to register for OnBoard. And again, once you are authorized, you can go to wcb.ny.gov/onboard. And we have a number of different materials and resources there that show you, how you can apply and what you need to apply.
Just one follow-up regarding the MMIS ID number. That is only applicable to durable medical equipment vendors. I'm going to paste a link from the eMed New York that will show people how to get that number if they need it. That's only applicable to durable medical equipment vendors. Thank you.
There's a question. Can a family nurse practitioner see workers' comp patients independently? Does it need physician supervision? Thank you. So the rules for nurse practitioners are consistent with the New York State Education Department scope of practice laws. So again, nurse practitioners require a lower level of supervision or collaboration, say, than physician assistants do. You do have to be authorized by the board, of course, and yes, primary care providers, whether it's physicians, nurse practitioners, PAs, et cetera, are all encouraged to be board authorized. And indeed, as was mentioned earlier, there's an added financial incentive for primary care providers as well. There's also a little bit of confusion, and just as a point of clarification in terms of if people are using the term board certified, when we talk about somebody being registered and authorized or permitted to see workers' comp patients, providers applied to the board to become board authorized. Typically, when we talk about board certified, we're talking about specialty board certifications, et cetera, separate and distinct from the comp board.
Just to answer a couple of recent questions, the nurse practitioner who does not yet have an office, you will have to have an office address before you can apply to become authorized. Somebody asked about the training required to become authorized. There is not a fee to complete the training.
There's a question asking how long the process is for onboarding. If you're talking about registering to use OnBoard, it's a very simple process. Go right online and follow the prompts and answer the questions. And it takes about 1 to 2 business days to get a response and to get your sign-on information.
On that topic of registering for OnBoard, just want to clarify, because sometimes there's some confusion. You needed ny.gov user ID and password. This user ID and password is going to be provided to you by the board. So if you already have ny.gov ID or password for anything else you might use for any other state agency, that ID and password will not work to get into OnBoard. It has to be provided to you by the board.
There's a question. I'm a psychotherapist. How do I go about obtaining referrals to my practice once I am board authorized? And I would say that two things. First of all, we would encourage you to become board authorized. There do seem to still be some questions about that. If folks have questions about where on the website and what to do in terms of applying for board authorization, please put them back in the chat, and Chris or one of us will be happy to readdress that. Secondly, all of our board authorized providers are listed on the Workers' Comp Board website, and that's updated pretty regularly, I think as frequently as daily, actually. And then finally, in terms of obtaining referrals to your practice, I will tell you that just like with regular healthcare, in general, there's a relative shortage of behavioral health professionals. So I think that you would relatively quickly be receiving referrals from your peers.
I see a couple questions regarding what I just mentioned about getting an ny.gov ID from the board to use OnBoard. You can request an ID by going to wcb.ny.gov/onboard. And on the provider overview section, I believe there's a link you can click on to access the medical portal. And then that'll take you right to an online application that you can fill out that the board will receive. And then they will, again, as Paul had mentioned, they will get back to you within a business day or two with your user ID and password.
The question came in again, does the provider have to be a Medicare provider? And just to reiterate, as providers, right, whether it's physicians, nurse practitioners, PAs, behavioral health providers, et cetera, you do not have to be a Medicare provider in order to become workers' comp authorized.
I saw a few questions with respect to acupuncturists, and acupuncturists can, in fact, they are eligible for board authorization as of January 2020, and also eligible for the CMS-1500 form as well.
This may have been mentioned, but there's a question about, can you speak to the training? Is it free? And yes, all of the trainings are on our website for free. Yeah, I should also mention, by the way, with respect to the trainings, all of them carry CME credits. So for those folks who require continuing medical education credits, those CME credits are free for you as well. So there's a question. I'm not affiliated with any organization or practice. Can I still become a workers' comp provider? And that came from a family practice nurse practitioner. And the answer is yes. You do not have to be affiliated with a hospital or a larger organization. You can be in private practice and still apply for authorization. Now, there's a question about how the CMS credits are awarded. With every module on our website, upon completion of the module, you answer some questions and it's all done electronically. You'll have a CME certificate that you can print, and one also actually gets physically mailed to you as well. I believe still.
He asked whether you're required to be authorized in order to treat injured workers. Acupuncturists, chiropractors, nurse practitioners, occupational and physical therapists, physicians, physician assistants, podiatrists, psychologists, and social workers who are licensed in New York State do have to be authorized to provide the services.
All right, so that is all the time we have for questions today. Again, thank you to everyone for joining us, and thank you to the team for being on hand to answer your questions. Before we sign off, I would like to remind you to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, please visit wcb.ny.gov. Scroll down to the bottom of the homepage and select Get WCB Notifications. Be sure to visit the healthcare provider specific page on our website, where we regularly share updates on what's new and important for healthcare providers to be aware of. You can visit the board's website and select the Provider Updates quick link on the provider page. Again, we do also distribute information via social media, so please be sure to follow the board on Facebook, Twitter, Instagram, and YouTube. And once again, we will be providing you with a recording of this presentation, and we will let you know via email when it is available. Thank you again for joining us. Stay safe and enjoy the rest of your afternoon.